So, acute inflammation can start when our immune system recognizes antigens from bacteria, because bacteria have structures called pathogen-associated molecular patterns. And also, if these bacteria die somehow, they will release other molecules called damage-associated molecular patterns, which can occur when they are killed by our immune system. But anyhow, we have immune cells in our tissues that are called macrophages and dendritic cells, which have these long dendrites. And these are professional antigen presenting cells. And furthermore, they have these receptors on them that is a type of pattern recognition receptors, which are called toll-like receptors. And these pumps and damps, they can bind to these receptors, and when that happens, these cells will activate and they will secrete a certain type of cytokine, which is called tumor necrosis factor alpha, among other cytokines, but this one is especially important. And this cytokine is pro-inflammatory, which means it will stimulate inflammation. And the way it does this is, first off, it will stimulate the endothelial cells, which lines our blood vessels, and the space between them will become bigger as a result of stimulation of this cytokine. And when the space is bigger, water with solids from our blood can go out into the extracellular tissue, and it will cause edema. And also, because blood goes in our tissue, it will become warm and also become red. This is also due to the fact that this molecule can increase the space in our blood vessels by causing vasodilation. And this occurs due to the release of nitric oxide from endothelial cells as a result of stimulation. And this nitric oxide will stimulate the smooth muscles in our blood vessel walls, which causes them to relax. Therefore, we will get increased blood flow